Hey everybody, this is Caleb Steffen, your host of Coast to Coast Plastic Surgery, your board certified plastic surgeon. Ready to talk about an article that somebody sent to me in Vogue magazine, which is not my typical reading, but was very interesting. It was about plastic surgery, and it was called in 2025. Everyone started being more honest about their plastic surgery, and it was by Audrey Noble, and it was written or published on December 31st of 2025. As we're closing out the first part of the year, it's interesting to look back and think about 2025 and the public perspective and perceptions on plastic surgery. And so there are a few things that I liked about this article. I think it's worth a read. One thing that you'll notice that I think is good when you're looking at when you're looking at um, public-facing plastic surgery commentary and articles, you want to consider the source. So one thing that was nice about Audrey's article is that it referenced multiple board-certified plastic surgeons, and I think that that's very important that the public seeks their information from people who are qualified to give that. So that's the first take that I noticed on it. Also, overall, the vibe of it was very positive, and I think that's a good thing. There's plenty of negativity out there, so keeping something positive and honest, but the next part of it is that it was reflective, is that the article itself kind of was a cultural introspection into how people feel about particularly cosmetic plastic surgery. Obviously, there's a lot more to plastic surgery than just cosmetic stuff. So just to dive into the article a little bit that was really focused on why and how people are being more transparent about their plastic surgery. They talked a little bit about increases in plastic surgery, and they attribute a lot of this to COVID changes, that there were increases in plastic surgery, in blepharoplasty, in nose surgery or rhinoplasty. Um, but that it was interesting compared those cosmetic plastic surgeries of the face and also of the breast and body were going up, that things like Botox and filler were going down. And I think there have been some social media trends on that were involved that those didn't really play into the conversation, but I think people are starting to appreciate some of the changes that only plastic surgery can offer. But people thought that uh, people became more open as their faces and their lives became more centered at home, and there was more screen time available, and then people just noticed other people sharing openly about their lives online, and I think that trickled over into plastic surgery about people sharing that. One thing that they noticed, that one quote from the article is that people are posting failures of surgery just as much as successes, which one of their plastic surgeons they interviewed thought that was positive. I think most plastic surgeons would agree that a happy patient tells one and an unhappy patient tells 10. So I would say that overall, there's probably going to be a counterbalance more about failures of plastic surgery or failures of cosmetic surgery, many of which would not be done by actual plastic surgeons, than there are in terms of positive stories. So, that, of course, that's something important to keep in mind. The other take on the article was that celebrities themselves were being more honest about plastic surgery they were receiving. And the sense was that if celebrities are sharing it and being open about it, then everyday citizens can be more comfortable with that as well. I thought it was interesting. They gave a shout out specifically to world renowned gymnast Simone Biles, who was open about her breast augmentation. And I think, and the rationale for doing so, and I think being willing to share something as important and as intimate with that publicly, I think there's nothing wrong with that. I also think that if someone wants to keep that private, that's perfectly reasonable as well. But it certainly gives people the sense that, some of these things are normal and you can have good reasons to do them that don't make you a strange person if you're being honest about having that. Um, there's been so much change lately, and my patients, at least, when I'm doing facial rejuvenation, eyelids, brows, facelifts, and so forth for that, and even of the breast and body as well, but people do not want to look weird or different. And we cannot improve as plastic surgeons on the actual ideal that is found in nature. And so the idea is when you're helping someone, what we want to do is help them feel better enough about how they look that they don't think about it anymore, that they spend less time worrying about how they look and more time living. And I think that that's a really important takeaway that I think we see from this article, and people realizing that that's what people actually want. They don't want to look silly. That's why breast implants are going smaller now, because that's more natural. Eyelid and face surgeries are not pulled as tight or as unnaturally as they were in the 80s. In the 80s and before. And also the article went into how we have extra treatments, like I'll do a facelift and a peel at the same time, those sorts of things where we can actually treat the different layers of the skin and give that full rejuvenated treatment. Um, I think injectables and fillers still absolutely have their place, and I have plenty of patients participating in them who want those same results, where they want to appear natural and good. But remembering that those are going to take you as far as they do, and they shouldn't be used outside of that context. And that's why it's great to have a plastic surgeon leading your care in that. Because there's been more transparency, Dr. Chang specifically noted that people have more decision-making capacity or more agency because they know more now. And I think that's a really good thing, is that you can lean on your expert to help you, but also you can have some shared decision-making in saying, this is what I want, or this is what would be helpful for me, how to look like. And so, one of the quotes from one of the surgeons is that something I frequently hear with my patients is where they feel like they finally look how they feel on the inside. And I think there's some value to that. At the same time, I think looking normal and looking your best is really a great goal. Chasing a number, not realistic, not something that you should do. Can plastic surgery make you look younger? Yes. Is that really a worthy goal? I don't know. Age is absolutely something that's immutable. We can't change it. Every day older, we're a day older. So looking your best is a realistic goal. I would say try to look your best. A plastic surgeon can help you achieve that goal. Don't chase age. And being honest with the people who will be supportive for you is a good thing. I think going out and telling the world and expecting everybody to give you a pat on the back for having plastic surgery is maybe not realistic, depending on which part of the country you live in. So judiciously share and honestly share with people that you think are going to support you. And certainly plastic surgery can still, even in the era of transparency, can be private for many individuals. And of course, we support that as well. Well, that's my take on that article. We hope you're having a great week and look forward to a wonderful 2026.
Hey, thanks for watching. We've got a lot more videos just like that one. We hope you check them out. So don't forget to like and subscribe our YouTube channel. We'd like for you to enjoy our content and share it with everybody you know. See you next time.